Greetings, Eric Baker, naturopath. Thanks for coming back. How do you test for autoimmunity? What are the tests that you can do? Do you only do medical tests, or are there other kind of tests that you can do? Or there are many types of tests you can do for autoimmunity. It really depends what you're trying to achieve, what you're looking for. If you go to the doctor, for example, you can do antibody testing. Anti-nuclear antibody, ANA, is a common test. So that will show if your immune system is starting to go haywire or starting to attack itself. That's quite a good starting test often. There's also RF, or rheumatoid factor. That's a specific one for an antibody production for rheumatoid arthritis. So different autoimmune conditions may have specific markers, antibody markers that the doctor will check for. For celiacs, there are specific markers. For Sjogren's, there are specific markers, for example. So inflammation markers, there are also non-specific ones like ESR, or erythrocyte sedimentation rate. ESR is a common one just to sort of gauge how the disease is going, if the person's inflaming a bit here or there, or if it's dropping off. So often through treatment phases, the doctor can see if you're in remission, or if the disease is powering ahead through studies like ESR. There are also more highly specialized kinds of studies called cytokine studies, where doctors can look more specifically at proteins that have been produced by white blood cells in response to inflammation. And these are called, for example, interleukin studies or tumor necrosis factor studies. These are more highly specialized and advanced tests that some doctors may perform, or specialists. But there are plenty of other tests you can do. For example, you could also do stool testing. All right. Now, stool testing is going to give you a great idea on the health of the microbiome. It's going to show you if there's any dysbiotic flora that need cleaning up, any bad bacteria or any bad yeast numbers. It'll also show you if there's inflammation in the gut, and what the status of your immune system is like in your digestive system. And that's called a comprehensive stool analysis, or comprehensive digestive stool analysis. So Doctors Data in Chicago do a new test now called the GI 360, which I think is fantastic. In my opinion, every autoimmune patient would best to do a stool test to determine the health of their gut, and then make some changes, improve the function of their gut to improve their immune status. That's the whole idea of doing that. So hair analysis is another test, for example, small samples of the hair from the nape of the neck to see if there's any toxic compounds in the body, because remember, toxins can also be a big trigger. There's also adrenal testing you can do, especially if you suffer from stress, or have had post-traumatic stress disorder, or have had a really gnarly kind of a lifestyle, or something bad's happened, or if you think that you're the type of person that needs assessing. You can do salivary cortisol testing to determine where your stress responses are, to see if you're in fight or flight predominantly, or if you're more in the rest and digest. But you need to see a naturopathic doctor or integrative doctor and discuss with her or him the applicability of these tests and what can be done. But getting testing done early on is clever, because it'll give you a baseline, right? And then having testing done regularly at intervals to see in which direction you're going. It's pretty hard to go anywhere these days without Google Maps or things like that. And in my opinion, without testing, it's like the dark ages without mobile phones. We didn't know where the hell we were going. All right, think about it. Tests are important, especially if you want to track your progress. Thanks for tuning in. Stay tuned. We've got more to come with the autoimmune series.